So the article that I recently published in AGIC about hand hygiene monitoring, I think is important because I believe that many hospitals are still kind of struggling with how to monitor hand hygiene. Most hospitals are still using direct observation, but because of some of the limitations of that method, there's considerable interest in automated monitoring systems. So some of the advantages of direct observation include the fact that it's really about the only method we have right now to monitor all 5 moments of hand hygiene as described by the World Health Organization. It's about the only method we have for monitoring hand hygiene technique, like how long do people clean their hands and do they look like they're covering all surfaces of their hands. It's something that can be used in all types of healthcare facilities, regardless of the level of resources they have. And if the observers want to, they can do just-in-time coaching. But some of the limitations are that there's a lack of standardized methods for performing observations, so you really can't compare hospitals. It's very time-consuming, like on average, you can do maybe 18 opportunities per hour of observation. There's almost always a Hawthorne effect, which sometimes can overestimate compliance by as much as 2 or 3-fold. And the other thing is that by observation, you can really only monitor usually less than 1% of all the opportunities that are occurring. With the automated monitoring systems, probably the simplest type is to just put electronic counting devices in dispensers, and this allows you to detect how many times people are using the dispenser. So it gives you some useful information about hand hygiene frequency, but it can't tell you anything about compliance rates. So I think most of the activity with regard to electronic monitoring are the use of these systems called either group or room activity monitoring systems, or systems that use badges. And I think some of the advantages of the electronic monitoring systems, either group or badge-based, is that you can record many, many more opportunities for hand hygiene than you can by observation. There's little, if any, Hawthorne effect. And with a badge-based system, you can actually get compliance rates for individual healthcare workers. One of the concerns that many people have about the electronic monitoring systems is that they don't monitor moments 2 and 3. And so we actually looked at this recently and found that if you compare large numbers of opportunities, like I found reports of over 600,000 opportunities, if you look at the compliance rate for all 5 moments and compare it to what the compliance rate is for just moments 1, 4, and 5, that the two compliance rates are within a few percentage points of one another. So if the electronic monitoring systems accurately reflect moments 1, 4, and 5, then you will have a pretty good idea of what the compliance rate is for all 5 moments. I'm hoping that maybe by reviewing the article that they will come to the conclusion that I think I have, is that perhaps the best information we're going to have on hand hygiene practices would be to use a combination of direct observation and automated monitoring, where you use direct observation as a more qualitative measure of hand hygiene, and then use the automated methods as your main quantitative measure of hand hygiene performance.